The families of some seriously ill hospital patients will soon be offered the right to a second medical opinion if their condition worsens. The government's back plans to roll out Martha's Rule from April, and this means an urgent critical review would be carried out by a different team in the hospital if the family feels they're not getting the care that they need. And all of this comes after the death of 13-year-old Martha Mills, who developed sepsis while at an NHS Foundation trust in South London. A coroner ruled that she would most likely have survived if doctors had identified the warning signs of her rapidly deteriorating condition earlier. Joining me now to discuss this, NHS GP Dr. Ellie Cannon and Polly Curtis, Chief Executive of the think tank Demos. Let's start with Dr. Cannon on this one. Dr. Ellie, I mean, everybody, I think most people know what it's like when you have a beloved relative, very close friend in hospital, and you somehow feel that there are signs that the condition is changing. You tell the nurse, you want to see a doctor. You don't feel that they really understand or get what you have seen, which is what you think is a change or something that's not being picked up. Do you think, therefore, this is a good idea to implement Martha's Rule?
I really, really do. I learned very, very early on in my medical career, actually from a professor of pediatrics, that a real red flag in terms of how ill a child is really how their parents feel about them. So if the parents are concerned, then you should be concerned. And that's something that stayed true throughout my medical career, and also, to be honest, as a parent as well. And I think there are signs and symptoms that families can see, that doctors can't necessarily see. We know our loved ones better than anybody. And I think this is a really, really essential move.
And you don't think it's going to burden an already stretched, very busy, short-staffed NHS with, over-concerned, maybe neurotic, maybe very demanding parents saying, we've got to have a second opinion, we've got to have it right now, and everybody's run ragged as it is. You're not worried that it'll be an imposition?
So in reality, that sort of type of thing sort of doesn't happen when we give our patients good access to healthcare professionals, especially for this type of sort of safety measure. It doesn't actually become sort of run ragged. Of course, you need the staff to do this. We learned the hard way through COVID that there's no point coming up with great measures like Nightingale hospitals if you don't have the staff to actually sort of undertake these measures. But I think this is absolutely critical going forward. I think there would be the staff to do this, to have that critical care assessment.
Thank you. Let me bring Polly Curtis in. What is the think tank saying about this, Polly? Does this seem to you to be a good development?
Yeah, so we worked with Martha's parents, Merapy and Paul, for months before this announcement was made and people started talking about this, to design the policy that sits under this. And it's based on cases around the world, in Australia, in America, and actually some pioneering hospitals in England as well, that have introduced something like Martha's Rule. And what it does is give patients and their families the right to pick up a phone and call a separate clinical team to come and review their loved one or themselves if they are worried that they are rapidly deteriorating in a very worrying way. So it's a real direct transfer of power from a hospital, from the clinicians to the patients. But all the evidence from where it's been introduced around the world shows that patients and their families don't abuse this right. They see it as something that they would only use where it's really, really urgent and it saves lives.
Well,
so
thank
where
you both very
doctors
much indeed. Thank you for bringing us up to date on this, explaining why it's so important.